Conversations on AIDS.gov. National Black HIV/AIDS Awareness Day is February 7th. The following is a conversation with James Albino from the White House Office of National AIDS Policy with federal and community colleagues.
While HIV is an issue that affects African American community every day, on February 7th of each year, we recognize National Black HIV Awareness Day. Today, I am joined by some of my federal and community colleagues from Washington, D.C. We will be discussing the HIV/AIDS epidemic in the African American community. First up is Ron Johnson. Ron, you have been responding to the HIV/AIDS epidemic as a community leader and activist for more than 20 years. Can you briefly share your thoughts on National Black HIV/AIDS Awareness Day?
Thank you, James. My immediate thoughts about February 7th as Black HIV/AIDS Awareness Day is to think about the devastating and continuing impact that HIV has on our Black communities. But I also think, and I'm reminded what the Black AIDS Institute tells us, we are greater than AIDS. And this Awareness Day gives us an opportunity to live out what that means. We can dedicate ourselves to education about HIV/AIDS. We can encourage everyone who is sexually active in our community to get tested so that they know their HIV status. And for those who are HIV positive, we can get them into care so they have access to the life-saving drugs that we know can help people with HIV. It's not a death sentence. You can live a long life if you take care of yourselves. And involvement and community, which are no strangers to the Black community. We can use that tradition to help end the epidemic in our community.
Recently, President Obama and Secretary of State Clinton have called for creating an AIDS-free generation. Ron, as Washington, D.C. gets ready for the International AIDS Conference in July 2012, how can we use this call to action and that conference to help respond more effectively to the HIV/AIDS epidemic in the African American community?
I was very encouraged when I heard Secretary Clinton talk about an AIDS-free generation. But I want to make sure that we as Black people are not left behind in that. And just as we've used HIV Awareness Day in the Black community, we can use the International AIDS Conference coming here to Washington to shine attention on the epidemic in the United States, certainly, but also the epidemic here in African American communities.
Thanks again, Ron. In Atlanta, Dr. Kevin Fenton from the Centers for Disease Control and Prevention. Kevin, why is National Black HIV/AIDS Awareness Day important to you and the work you do at the CDC?
James, thank you for that question. As you know, we have a national HIV/AIDS strategy that directs the nation to focus its prevention efforts on communities at greatest risk, including African Americans. National Black HIV/AIDS Awareness Day gives us all a greater opportunity to reverse the HIV epidemic in Black America and the nation as a whole. This observance can help to make sure that prevention messages get to those who need them most. In addition, this day provides an opportunity for all of us to increase our awareness of the scale of this epidemic, as well as recent breakthroughs in HIV prevention and treatment. Personally, this day is a time to reflect on the progress we've made and the important work that lies ahead. We still have much to do to confront complex social and environmental conditions, such as lack of insurance, stigma, homophobia, all of which help to fuel the HIV epidemic in African American communities. And we must work together to address these factors. On National Black HIV/AIDS Awareness Day and on every day, we must work to educate, inform, give hope, and build momentum for HIV prevention.
Thanks, Kevin. As we just mentioned, President Obama and Secretary of State Clinton have called for creating an AIDS-free generation. On this Awareness Day, what suggestions do you have to help people support that important goal?
To create an AIDS-free generation, African Americans and all communities across this nation must do the basic things that we know work. For individuals, not having sex or being sexually active with only one person who has agreed to be sexually active only with you are important ways to reduce the risk of HIV infection. The correct use of latex condoms each time you have sex is highly effective in preventing HIV as well. Getting tested for HIV is a vital step to protect oneself and others from HIV infection. CDC recommends, and I encourage everyone between the ages of 13 and 64 years to get an HIV test. Getting an HIV test is the first step in finding out if you have HIV and getting medical care. Now, with scientific breakthroughs, there's new hope today for stopping HIV in the United States. We now have a tool for HIV prevention, a pill that when taken daily reduces HIV risk for gay and bisexual men and can do the same for heterosexual men and women when combined with other effective prevention approaches. We also have research that shows us that early treatment of HIV-positive people can reduce their risk of passing the virus to their partners by 96%. Empowered and mobilized communities are one key to the realization of an AIDS-free generation as well. For National Black HIV/AIDS Awareness Day, the Black community is mobilized at events across the nation and in communities across our country. Leaders from every walk of life, business, civil rights, entertainment, government, and media are speaking out and are taking action. Today, I call on the faith community, on the public health and community leaders, teachers, parents, and business leaders, both within and outside Black communities, to recommit ourselves to maximizing these powerful tools at our fingertips and to work to finally bring this epidemic to an end.
Thank you, Kevin. And now I have Dr. Deborah Parham-Hobson from the Health Resources and Services Administration. Thank you for joining us from the studio. Why is National Black HIV/AIDS Awareness Day important to you?
This day is so important because I know firsthand the impact, the devastating impact that HIV/AIDS has had on the African American community. This day affords us the opportunity to talk about HIV/AIDS, something that we oftentimes are hesitant to talk about. But it's only if we talk about it that we can learn how we can prevent new infections, and if you are infected with HIV, that you can get into care. But first, you need to know that you are living with HIV, so you have to get tested. So this is an important day where we actually spend time educating each other about HIV/AIDS, getting tested, and if positive, being linked into care. Because we know that if people are identified early living with HIV and they come into care, then we can keep people healthy for long periods of time.
Thank you, Deborah. Thanks to all of you for taking the time today to answer these questions. To learn more about HIV in the African American community and the National HIV/AIDS Strategy, please go to AIDS.gov. Thank you for watching.